Welcome to the Human Momentum Podcast. I'm your host, Eric Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and sometimes contradictory health information found on the internet. I want to distill all this information down to a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do the things you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Welcome to the Human Momentum Podcast. Today's episode will be the first in a new series of episodes I'm putting together to highlight medical content creators I find myself watching regularly. My time and ability to digest new research and new clinical knowledge has some finite limits. And as I'm trying to deliver the best and most current content possible for all of you out there, there are researchers and clinicians I lean on to help digest some of the most up-to-date information. In today's episode, we're going to check out excerpts from an interview with Vonda Wright M.D., an orthopedic surgeon whose practice is somewhat atypical in that she focuses away from surgery and medications and tries to focus in on exercises and lifestyle modification in order to maintain the best possible orthopedic health. As such, she's someone I have started to lean on more and more, and whose content I'm digesting a lot of to try and keep up to date on these topics. So without further ado, let's check out the first excerpt from this interview.
When I had a stem cell lab and we wanted to damage cartilage, which is the smoother than ice glistening end of a bone, all we really had to do is drop a marble on it, as it's very pressure sensitive. That being said, our joints themselves require mobility to be healthy, because the way we feed our joints is through the pressure of the fluid in the joints. It's like,
So it's almost like a rubber. If you've ever seen an old rubber band that gets brittle,
that's like a tendon that gets brittle, right?
So like stretching the rubber band actually keeps it healthy.
It does. Moving muscle, moving joints, lubricating cartilage with mobility keeps everything healthy.
Okay, so what drew me to this clip was Dr. Wright talking about the idea that motion and activity are necessary for optimal joint health, and stressing our joints is probably much more helpful than harmful. It's sitting still and not moving our joints that leads to more degenerative processes than anything else. Just so you're aware, when Dr. Wright talks about cartilage in joints, what she is talking about is the smooth connective tissue that coats our bones and is between the joints that allows them to come together without damaging the bone and allows these joints to move smoothly over one another. It's this surface that degrades over time in osteoarthritis and other degenerative processes and can lead to a lot of joint problems when you get older. Now, we used to think that this osteoarthritis process was a wear and tear driven process, and that it was mileage and cumulative trauma over the years that caused the cartilage to break down. We are now recognizing with research that this is largely not true. And what we are finding out that it's a lot of poor metabolic health that drives it beyond anything else, sometimes combined with physical injuries and trauma. This is entirely consistent with my clinical experience treating patients for chronic pain, frequently from arthritis. I always saw the greatest incidence of this type of degenerative arthritis in individuals who were very sedentary. It wasn't the runners, the weightlifters, and the highly active people that I saw getting advanced arthritis over and over again. They may have had their issues with pain, but it wasn't from that most of the time. It was individuals who were working in an office and very sedentary. They were the ones who, again and again, I would see with advanced arthritis, particularly if they had conditions like diabetes or prediabetes, or they were just overweight and out of shape. Now, I'm not saying that to shame anybody if they get these conditions, not at all. It's very difficult in modern life not to prioritize work and to prioritize caretaking for family and not do the things that you need to do to take care of yourself and keep your joints from kind of breaking down on you as you get older. What I'm much more interested in is talking about what we can do to start to turn this around without just prescribing pills and prescribing injections to try and correct the problem. Let me know if you would like to hear a lot more about the kinds of things we can do to improve metabolic health and hormonal health in such a way that it supports our joints, as well as knowing some of the kinds of exercises and mobility therapies that can be helpful in improving osteoarthritis related pain and limitations. I'll be happy to do a future episode focused in on that topic. Just let me know in the comments. All right, with that said, let's move on to our next excerpt.
And when I listen to you talk about the medicine of mobility, or that movement is medicine, and then I hear you as an orthopedic surgeon and a renowned expert in longevity and in aging in a way that is vital and joyful and powerful and strong, and that's an option for all of us. What I also am hearing is that so many of us buy into the lie that getting frail and slowing down is inevitable.
Yeah.
And then you'll take a pill. And then the pill is meant to address symptoms that you feel. And what I think is very exciting is putting the power back in our hands. And as you're listening to Dr. Wright, she's basically saying your body is actually designed in this extraordinary, glorious way to work for you, to make you feel better, to build muscle, to help you live a full and amazing life.
All right. So the reason I included this clip is to emphasize the idea that movement is medicine and to really kind of share the philosophy that Dr. Wright is trying to espouse here, because it very much is in tune with mine. Medication, injections, and surgery certainly have their place in controlling symptoms and helping people get mobile again when advanced disease has gotten in the way of it. But it's motion that actually addresses the underlying issues and gives people the capability to continue it to be active as they age. I've even come to see the osteopathic manipulative therapies that played such a large role in my time in medical practice as an adjunct to motion. It's osteopathic manipulation, relieving pain, and improving the efficiency of motion that allows people to get moving again in many cases. But if they don't get moving again, nothing stays better. With that in mind, I want to progress to the final excerpt here and see if we can close things out.
And so I see this vibrant woman at the peak of her career in exactly what you're saying. She has knee pain and arthritis, and she's not even as old as us. So I could have taken a purely medical route with her. I could have said, okay, I'm going to shoot you up with steroids every few weeks, which I don't do. But I mean, I choose not to treat my patients with that remedy only. I could have said, okay, when you're ready for a total joint, let me know. But knowing that the body will respond with strength to the positive stimuli, we cut out all the inflammatory foods in her life.
I wish the clip that these excerpts were pulled from had continued a little longer so that we could have heard a little bit more about how Dr. Wright approached treatment for this patient. But I think I can surmise a little bit from what she has said already and for what I've seen of her before. She's going into lifestyle factors that are going to improve general inflammation, particularly joint related inflammation. And that means changing the diet in such a way to improve metabolic health, removing potentially pro inflammatory foods and trying to eat an optimal diet for metabolic health. For me personally, when I was taking care of patients with arthritis, it also meant evaluating beyond diet to look at things like alcohol consumption, tobacco consumption, and sleep to try and optimize overall metabolic and joint health. And we would often need to include continued refinements to our dietary approach to try and get people to a point where we are minimizing joint inflammation and maximizing metabolic health. And finally, it also meant evaluating some blood work to look at things like hormonal axes that could potentially affect joint health. This would include the sex hormones, it would include insulin, and it would also include thyroid hormones. Additionally, I would take a peek at some vitamin axes, particularly vitamin D and some B axis related lab tests. And I would be checking certain electrolyte levels, as well as potentially giving a trial of magnesium supplementation for a patient to see if that would help improve symptoms. That's the sort of comprehensive approach, folding that in with an osteopathic evaluation, manipulation, and referrals for neuromuscular control exercises that I would take with patients that had osteoarthritis and related pain issues. And I think it's that kind of comprehensive approach that's necessary to try and get the best possible outcomes with the medical knowledge we have. Well, thank you for checking out this episode. I'm going to include links to the original clip that I pulled these excerpts from, as well as Dr. Vonda Wright's YouTube channel that I think can be a wealth of knowledge for musculoskeletal health. Thanks again for watching. If this is your first time here, please do subscribe to the channel. If you found this informative and interesting, a like really helps us get this out to more people. And finally, if you know somebody who can benefit from this information, please do share the video with them. I'm hoping to eventually make this something I can do full time, and all of you getting this out there really helps with that effort. Thanks again, and I'll see you next time.